the South Dakota Department of Health. All information provided on this call is considered on the record, and any request for clarification post-call can be sent directly to our Communications Director, Daniel Buccielli, at state.sd.us. On this call, this is an on-call. This is an on-call or on-the-record call, and will be structured in the manner to provide the most updated information on South Dakota's response to COVID-19 and discuss the next steps moving forward in combating this virus. Today's call will cover updated vaccine efforts throughout the state, as well as we will be discussing new features on our department COVID-19 dashboard, both of which will be helpful for your reporting. This includes our daily vaccination tracker and tracking tools reporting on the deaths and state results for COVID-19. Joining us today is the Secretary of Health, Kim Moster-Rison, State Epidemiologist, Dr. Josh Clayton, and South Dakota Department of Health Communications Director, Daniel Buccielli. At this time, I will turn it over to Daniel Buccielli for the most up-to-date COVID-19.
Good morning, everyone. Thank you for joining today's conference. Since the beginning of the pandemic and before then, South Dakota's Department of Health has thrived on bringing South Dakotans and members of the media the most up-to-date health information available. During the worldwide pandemic, this is no different. From the Secretary to our staff, we've dedicated countless hours in helping our state better confront the challenges posed by COVID-19, and we will continue doing so. We believe in empowering our citizens with accurate and updated information, which better allows them to make decisions for themselves, their families, and businesses. To that end, here's the latest statewide COVID information as of this morning. New confirmed cases, 677. New probable cases, 228. Active infections, 10,987. Recovered cases, 80,316. Currently hospitalized, 412. Total tests confirmed, performed, 696,690. And that is with 355,614 unique persons tested. We're currently reporting the RT-PCR positivity rates, and that is a good measure being used by CDC as well as CMS for nursing home long-term care facility reopening plans. The last 7-day number as of this morning is 9.9%. Just as a reminder, all of this data can be found on our COVID-19 dashboard, which can be found at DOH.sd.gov. I will now turn it over to Dr. Clayton and Health Secretary for exciting news on our dashboard features.
All right. Thank you, Daniel. Thanks for the recap of our current numbers. We do have, beginning today, we do have a number of modifications to our COVID-19 dashboard that I'm excited to share with you, including updates on COVID-19 vaccinations and COVID-19 related deaths. With some of the updates, I'll first talk about changes to the Trends tab. So we have moved the influenza-like illness data to a new hospitalization and ILI tab to allow for the percent RT-PCR test positivity rate by date that those tests are reported to the South Dakota Department of Health. You will not only see the positivity rate, but the number of viral molecular tests that were positive and the total tests that were reported on that new line graph at the bottom of the Trend tab. There have also been some questions about what days are included in the test positivity rates that we have been reporting. So you will now see those explicitly denoted under the 1-day, 7-day, 14-day, and cumulative test positivity rates. It's also important to note that these rates are updated daily, which differentiates them from the percent test positivity weekly rates that are located in the Tables tab. The other next update that I'd like to mention is on the Hospitalization and ILI tab. We have, this tab now includes, as I mentioned, the influenza-like illness data that was previously found on the Trends tab. We're also showing at the top of that tab the positive cases by date of hospitalization. So as you can see, the number of hospitalizations in the past few weeks has started to decrease. The next update is on the death tab, which is, we have, if you're taking a look at that, we currently have 1,300 deaths among people with COVID-19, and those deaths are counted as a death according to the National Surveillance Case Definition. It should be noted that this National Surveillance Case Definition that is used by all states across the nation is a broader definition that is used by the National Vital Records Surveillance System, as it includes both those that are listed on the death certificates as a cause, as deaths caused by COVID-19, as well as deaths where COVID-19 was listed as a significant condition on the death certificate. And finally, including those individuals who it may not be listed specifically on the death certificate, but the deaths are among individuals who were infected with COVID-19 within 20 days of their specimen collection date. Excuse me. The next item that you'll see on that deaths tab is the 1,159 deaths that are caused by COVID-19. And this is directly related to deaths that are listed on the death certificate as a person who died where COVID-19 was listed as the immediate or underlying cause. So again, deaths due to COVID-19 directly. And we also have additional information in that deaths tab, which includes for long-term care facility cases and deaths among those residents. So we have currently 2,926 cases among long-term care residents, and we have seen 632 deaths among those long-term care resident cases. As you scroll down that tab, you'll see that the deaths among persons with COVID-19 by date of death is shown on a bar chart. And so you can see that we have had a decreasing number of deaths in recent days as well. Finally, on the vaccines tab, we are showing the total doses that are administered, and that total number is, as of Monday and Tuesday, shows 405 doses being administered in the state of South Dakota. Below that, you'll see, below that total, you'll see the total number of doses administered by the vaccine manufacturer. And it should be noted that currently Pfizer BioNTech is the only vaccine that is available via FDA emergency use authorization and ACIP approval. The dashboard also shows the total persons administered a vaccine, and so that currently shows 405 persons, each of those with one dose of vaccine. Below that number, you'll see the persons administered one dose of vaccine, and in the approximately 3 weeks when the second dose is due for that first round of individuals, you will start to see persons identified with the Pfizer vaccine being a completed series in that same space. The next information is shown on the doses and persons administered vaccine by county of residence. So this is a map, and you can hover over the county of interest, and you'll see not only the range of doses that have been administered in that county, but the exact number of doses and the exact number of persons who have received a dose within that county. Below that map is a table showing the same information for easier comparison by county. And lastly, you'll see the number of persons who received one or more doses of vaccine by sex and by age group on that tab. The other thing that I would like to mention is that this data on the vaccines comes from the South Dakota Immunization Information System. and it's vaccine allocated to the state of South Dakota. The dashboard does not include the vaccine, any vaccine that is administered to tribes by the Great Plains Indian Health Service, as that vaccine is allocated federally to IHS. The last thing I would like to mention before I turn it over to Secretary Malcolm Reisden is that with the positive news of vaccine arrival in South Dakota, and you can see the number of individuals who have received that vaccine, it is important to remember that vaccine is only one tool that we use in the prevention of COVID-19, and that we are still asking individuals whether they have not received any doses, received one dose, or received 2 doses of vaccine, to make sure that they're taking precautions, which does still include maintaining physical distance of 6 feet when possible, wearing a mask when maintaining that distance is not possible, and making sure that you have good cough and hand hygiene, as well as you're cleaning high-touch surfaces such as countertops, tables, light switches, remote controls, all that sort of stuff that you've been doing all along throughout the pandemic. So with that, I will now turn it over to Secretary Malcolm Reisden.
Thank you, Dr. Clayton, for that update. I'd like to just quickly recap some items so that you're able to share this because we think this will be of interest to all South Dakotans. And so, again, I think as people are aware, since our last call, the vaccine has arrived in South Dakota. And I will just tell you that Monday was a great day for many of us, longly anticipated and really excited about what the future brings now that we're seeing vaccine delivered here. So Operation Warp Speed, that's the federal entity that is delivering vaccine to states. The allocation to each state is based on their percent of their population. So that's how we're getting the doses that we're getting. It's the same across all states. South Dakota received 7,800 doses of the Pfizer vaccine, and we are confirmed to receive 14,600 doses of the Moderna vaccine next week. Again, we are working with several healthcare partners across the state to administer this vaccine during our first phase. I'd also like to let you know that our vaccination plan is on the covid.sd.gov website, along with a new infographic that really shows the priority populations in phase 1. And so I just want to walk you through that very quickly. So as you know, we're starting with our frontline healthcare workers that are taking care of people with COVID in emergency department, ICU, COVID acute type settings, as well as our long-term care facility healthcare workers. So that's really that first group that we're working to vaccinate yet this week, and will continue into next week. Our next priority group within phase 1 are our long-term care residents. So we anticipate vaccination of that group to start yet this month. And then, as Dr. Clayton has indicated, the second dose will be provided either 21 or 28 days after that first dose. From there, the next priority group are our other healthcare workers in the state, as well as first responders, including public health workers, emergency medical services workers, law enforcement, and correctional officers. At that point, the next group will really focus on some of our vulnerable populations in the state. So that includes individuals with 2 or more underlying health conditions, people that are over age 65, people that are people that live in congregate settings, independent living type settings, group homes, and then some of our critical infrastructure to include teachers and other school and college staff and funeral service workers. From there, we will move on to other priority populations in phase 1 to include fire service personnel and other critical infrastructure workers. So we know people have had a lot of questions around where they might fit. So we hope that that's a useful tool to all of you. We will continue to share what the state's allocation of vaccine is as we get that information from the federal government. That schedule will really dictate how quickly we can move through the different groups and get them vaccinated in phase 1. Again, we've been working with over 35 partners statewide to kind of accomplish, our planning efforts and our vaccination implementation, and we will continue to report out now on the dashboard on a daily basis. I want to make one quick pitch before we turn it over to questions about vaccine safety, because I know that's on the top of a lot of people's minds. And so I think everybody is quite aware that the health and well-being of our citizens is, of course, our number one priority. The U.S. vaccine safety system is among the strictest in the world. And no vaccine that does not conform to U.S. standards would be approved. And so even though the vaccine that we're using right now and then the Moderna vaccine, which is expected to be approved, are being released under an emergency use authorization, that does not mean that the safety parameters or rigorous scientific procedure were not used. To the contrary, these authorizations required as much oversight as we would see with regular approval processes. The other thing that's important is that there's continuous monitoring of the performance of the vaccine, and safety protocols and health data are both collected and analyzed daily at the federal level. So we feel that those protections are very helpful for people to understand, and that the public can be sure that this is going to be taken very seriously, and that safety will continue to be the number one concern as we move forward. So with that, thank you for helping us report out on kind of these new developments, and we're ready for questions.
Okay. Thank you, Madam Secretary and Dr. Clayton. At this time, we are going to open the floor for questions. If you would like to ask a question, please identify yourself and your outlet. Who would like to go first?
Yes, Todd Epp, Kello.com News.
Go ahead, Todd.
Thank you. Apparently, the American Healthcare Association and National Center for Assisted Living have conducted research on nursing home providers, and they have some kind of disturbing numbers about not just the health of the residents, but the health of the facilities themselves. And I'll just give you a couple statistics. They say 2/3 of nursing homes, and this is nationwide, say they won't make it another year given current operating pace due to current increased COVID costs, and also says that only most nursing homes are either operating at a very slim margin or are operating at a loss. So I guess this is for Secretary Malsom-Risden. Are you concerned about the health of our long-term care facilities given the impact that the coronavirus has had on staffing, patients, and I suppose any number of economic issues?
Sure. Thank you, Todd, for that question. Certainly we want nursing homes and assisted living centers to be viable so that they can provide the needed services to vulnerable people across our state. The financial situation of nursing homes is something that they've been raising now for some time, and so I wouldn't say that the concern, just started with COVID, although we do know that there's fewer people actually admitting into nursing homes and assisted living centers, and so censuses have been lower here in the last year or so. Governor Noem did announce economic relief to nursing homes, and we can follow up with some of the details around that, but she did that expressly to help make sure that they remain financially viable through this COVID pandemic. Of course, that's in addition to all of the health and safety work that we're doing alongside nursing homes, including just last week announcing a financial incentive for nursing home staff who take part in some CMS infection control training. And so I would say that we've done a lot of different things to help support our long-term care industry in the state, both financially and otherwise.
So, Madam Secretary, do you think there are homes that we're going to be closing in 2021 as we begin to pull out of this, or do you think what's the general health of those facilities in the state?
Yeah, so kind of in a general way, we've seen nursing home closures over the past several years. We actually have not experienced any closures since the beginning of the pandemic. However, last fall we experienced a few closures. We do have a report kind of on the status of nursing home closures that we could also send you if you're interested in the topic more broadly, but it's not unusual to see, nursing homes that, especially if they experience very low occupancy, to make the decision to close.
Okay, thanks. I'll follow up with the department offline. Thank you.
Thank you.
Can we have the next question, please?
Yeah, this is
Jackie,
Jonathan with the Argus Leader.
I heard August Leader.
Yeah, thank you. Hey, just quickly, as you guys know, our newspaper requested more information on deaths and sort of what was behind those, and we were told by your general counsel that there wasn't enough information to give us that information, that we didn't provide, that you couldn't find the records, I guess. And so now we see that on the data dashboard there is that information. So can you kind of explain the contradiction there?
So, Jonathan, this is Kim. I think what the answer to the request was is that we could not release individual death certificates, which was what was being requested. And so there's a process for entities to request those kinds of documents, and if we don't have certain identifying information, then we're not able to produce those particular certificates. Now, what we did want to do is provide more information in the aggregate around deaths among people with COVID and deaths from COVID, so that we could all be very clear on how COVID is impacting people in our state. And so that was the purpose of the dashboard update. And as Dr. Clayton indicated, we'll be sharing some more information from our vital records arm of the department later today. So that, I think, will be helpful for folks that are interested in that data.
Okay.
Thanks.
You're welcome.
I believe
Morgan at the Rapid.
Go ahead, Morgan.
Can you go into the next steps to get the vaccine to the rest of the hospitals and clinics in the state? Like, is the plan to kind of get through phase 1A just in Minnehaha and Pennington counties first, or will you kind of keep going with that, but kind of spread it out to other areas of the state?
Sure. So thank you, Morgan, for that question. So the very first doses of the vaccine are the Pfizer doses that we have this week. Those are the ones that we have the ultra-cold storage requirements. We asked our phase 1 vaccinators to focus on Pennington and Minnehaha counties, as well as Mobridge, Brookings, Huron, and Watertown. With the Moderna vaccine that we will be getting next week, that does not have the ultra-cold storage requirements, and so that is where we will have the ability to get out to healthcare professionals in that very first phase in other locations.
And then I also just wanted to ask quick if the VA hospitals are part of, South Dakota's response, or if it's like up to the federal government to get the vaccines out to them.
So the VA is actually part of the federal government's allocations, and so similar to the Indian Health Service, they will be handled outside of the state allocation.
I believe our next question was from Jackie.
Hi, thank you. I'm curious if you can talk to us about kind of how wide the window is for the second dose of the Pfizer vaccine. If something were to go wrong, a delayed shipment, or an individual, for whatever reason, couldn't get in on their scheduled day for the second dose, what happens in a situation like that for that person?
Sure. Thank you for the question. So when we do have individuals who, and this is true of any vaccine, that there is a window of ability to receive a vaccine, typically about 3 days before the dose is due, and for most of our vaccinations, there is no period in which they would need to restart vaccination. And so with the Pfizer vaccine, we have the same sort of window period, except it is 4 days. So an individual could receive the vaccine starting on day 17, and ideally that vaccine would be given no later than day 25. But because we know that, there's the ideal world and then there's the real world. And so if an individual is receiving the vaccine after day 25, that person does not need to restart their vaccine series, and that they are just to receive, as soon as they are available, that second dose of vaccine.
Next question, please.
Jack
Ray
Cobble,
from
KDB, KOTA.
Ray from Keloland.
I heard Jack, and then we'll go to Ray with Keloland.
The at-home tests that the state was talking about last week, how accurate are those in relation to what you would go get in at a clinic, and what role do they play in this whole big picture?
Jack, thank you for asking this. I'll start and then turn it over to Dr. Clayton. So the saliva at-home tests that we are offering, and there is a handy link on our website to access those tests. So please help us get the word out about that. Those are RT-PCR tests, and so that is considered the gold standard. It's a molecular test, and it's very sensitive, and so we have absolutely no qualms about the quality of those tests.
So this is Dr. Clayton. The testing landscape that is out there does include those molecular-based tests, which includes primarily RT-PCR, as well as antigen tests. And so those molecular tests can be used, across the board, whether an individual is symptomatic versus asymptomatic, and there's no concern about that testing, that test result needing to be taken into context with in any sort of symptoms that the person may have. So again, that saliva-based testing that is being offered to close contacts is that molecular-based test. And so we would anticipate that it would be comparable to and almost any other testing option out there across the state.
Okay. I believe Ray has our next question.
Yeah, I have two quick questions. One is related to the vaccine. With Moderna and Pfizer, will you have enough vaccines to vaccinate the essential workers that you identified a couple weeks ago? I felt like there was like a 2,000 or 2,500 gap.
So, Ray, we do not know what our future allocations will be, and so, again, we will be sure to keep everybody informed in terms of what we know we're going to be provided, and then where that gets us on those priority populations. So we can't answer your question at this point because we just don't have the numbers.
Okay, I guess I'm talking about the initial 2 doses of 7,800 and the 14,000, roughly 600 total, compared to the total you gave us for the workers that would be the first to get this in terms of hospital and long-term. There's a gap there. You have more workers than those doses.
Well, no, actually, no, we don't. So I'll just kind of go through the numbers again. In that very first phase of healthcare workers, so again, these are frontline healthcare workers taking care of people with COVID, and our long-term care facility workforce, we estimate that to be about 19,000 individuals. And in our first dose of Pfizer, that's 7,800 people. And then with Moderna, that's another 14,600.
Okay.
So we're confident that we'll be able to get through that initial group with our first 2 allocations.
Okay, thank you for clarifying that.
You're welcome.
And if I can, just a quick question on the positivity rates for the last 7 days. I'm confused by that because it's 9.9 for the state, but we only have 9 counties that are less than 9.9% for their weekly positivity rates. Some are 44, some are 33, some are 28. I can't make that math work. Can you help me?
Yeah, again, the time period that if you're looking at that 7-day window right now, it includes the last 7 days with the last 7 days last full 7 days that we have tests for those RT-PCR tests. Versus that table that shows the percent positive test rate is based on the past week. So there's always going to be a difference in that, except for 1 day per week, where those numbers should align. So just taking into account the different time frame, right now, if you're looking at those, they will be different. Looking at that past data, yeah, you're exactly right. It will depend on the total number that are negative and the total number that are positive within those different time periods to equate to that percentage. And so, when you're looking at, take a look at the statewide numbers, and if you have any additional questions, please do reach out to us, and we can explain that via email.
Okay. Thank you.
Mm-hmm.
Okay. We have time for one more question. Can I have the last question, please?
Jeremy Fubelberg, Forum News Service.
Go ahead, Jeremy.
Yeah, the question that I have is about requiring a media RSVP for this call. I'm just wondering what's the thinking behind that request and what will be done with that information that's gathered.
Jeremy, this is Secretary Melson Rice, and the purpose of the request was so that we can better get responses back to people that have questions that we don't get to fully. It's not being used for any other purpose. It's really meant to help us help you. And I'd let Daniel add anything else.
Certainly, just as an example, this morning after this call, we will be sending out the priority groups phase 1 chart that we described in the call. So this is just one example of how this information is being used.